Hello everyone. Today we are interacting with a very experienced doctor who is one of the leading senior surgical oncologists, cancer surgeon of Bangalore. He is one of the pioneers of laparoscopic cancer treatment. Although he is someone who does not needs an introduction and is well known by everyone, still let me make this opportunity to introduce him. He has done his graduation, post-graduation and postdoctoral training from some of the leading medical colleges. He has a fellowship in laparoscopic and robotic oncosurgery. In the medical career spanning from 1999, he has widely traveled and has worked in many reputed centers all over the world. He is a member of Royal College of Surgeons of Edinburgh, UK, and many other professional associations. Currently Director of Surgical Oncology, Fortis Cancer Institute, Bangalore, and also working as robotic laparoscopic oncosurgeon with Max Clinic, Bangalore. So without wasting further time, let me have the opportunity to invite Dr. Sandeep Nayak, our cancer specialist. So sir, let's hear it from you. Anything you would like to add on about yourself?
Thank you, Manav Sharma. So it's good, I think you have given pretty much everything. In fact, you have covered whatever you wanted to. And I think you have given my brief CV that is quite good. So I think, I have nothing more to say about myself. So please go ahead.
So pretty good to know that we have done our part on the research and good to know about that, sir. So let's begin with this interactive session with our prestigious Dr. Nayak. So, sir, my first question is that what are the different types of cancer and how does one get it?
So, see, cancer, very often when patients come to us, they think cancer is a single entity. Means, cancer is the diagnosis itself. It is not. So, cancer is a name given to a group of diseases. So, cancer can be from any part of your body. So broadly, when we talk about cancer, we talk about solid tumors, means solid cancers which make a tumor, like you feel a mass or a lump or whatever you feel. That is one type of tumor, cancer which is solid tumor. And the other side of it is the liquid tumor, what we know, what we call as blood cancer. So this is the broad classification. So if you want to look at various aspects of it, we can discuss as we go on also. But broadly speaking, the solid tumors where a lump or a mass is formed, they are treated mainly by surgery, and the liquid tumors are mainly treated by injections or chemotherapy. Though there is an intermingling of that, I'm talking about the main form of treatment. So it's a huge variety of things. And also, I think you asked me what causes it. See, the very fact that we are there means, we are imperfect beings. We have, we have many issues. We develop throughout our life. We develop various forms of diseases. So disease is a feature of life. So there was a time when people used to develop infections. Now we are talking about COVID infection nowadays. Before, people used to die of many other infections like COVID at a much younger age. Like people used to die of measles, people used to die of TB, people used to die of plague. So there were many cancers, many diseases because of which people used to die. Today, they are all reduced. Only today we are talking about COVID, but that also will pass. But eventually what is happening is, we are dealing with more of non-infectious diseases, and that is why it is coming. And of course, there are many ways people can, there are lifestyle changes which can avoid cancer, reduce the risk of cancer and all that. But overall, the very fact that we are alive, we are prone to diseases, and cancer is just one of those diseases.
So thank you, doctor, for your valuable answer to this question. So my next question is, can cancer be passed through generations?
Yes, the question is actually, is it a hereditary disease? Means, can you get, if your parents or anybody else in the family have it, can it come to you? The answer is yes, it can, but it is not that every time it will come. So, see, there are when we classify cancers in that way, we there are many genetic disorders or DNA. You must be familiar with DNA, isn't it?
Yes, sir.
DNA is the main genetic component of every one of us, or entire life, entire life form, including bacteria. Everything has DNA. Now, the damage in the DNA can be transmitted if the DNA damage is in the eggs and the sperms of the parents or that particular family. So, but that occurs in only about 5 to 10% of the cancers. So, more than 90% of the cancers are actually not because of genetic; they are because of what you have done to yourself. Okay, it is not because of your parents had something because of that you got. So generally, most of the cancers are not hereditary, but we know we look at the history. There are many things which we assess when the patient comes to us. We assess multiple factors and then decide whether this particular patient is eligible for te- tests for genetic, whether it is a genetic test, hereditary test is required or not. We decide based on multiple factors. So it is not as simple as that, every patient who walks in, we just because we ask whether your family had any cancer doesn't mean that, if your family didn't have cancer you cannot develop it. In fact, most of the people who come with cancer don't have a history of cancer in their family. Okay. And very another very important point also I want to clarify here. Very often people think, cancer will spread from person to person. No, it does not spread from person to person. You can sit and eat in this from the same plate also, nothing is going to happen. You can live with the person, nothing is going to happen. It can never spread from person to person. Okay.
Oh, I did not knew that thing that it does not. We can actually take those things into consideration. So thanks, doctor, for letting me and the audience know about that. So moving on to the next question. So what are the common symptoms of cancer, and how we can actually detect that we are or anyone is suffering from cancer?
See, there is no one symptom which we can call as a symptom of cancer. The cancer symptom is related to the part of the body that is involved. So, if there is cancer in the stomach, the feeling that the patient gets is just like the patient has gastritis. So, gastritis is a very common disease. So, the feeling is same. If there is a cancer in the rectum is the lowermost part of the intestine where we know we are passing motion. Patient, many of them will pass blood in their motion, but they'll pass blood in the motion even when they have piles also. So so the symptoms of cancer are not specific for the presence of cancer. So so that is why generally what we recommend is any kind of symptom which does not vanish or does not come down in 3 weeks or 4 weeks needs to be investigated properly. There are many other criterias. For example, I spoke about gastritis. Every gastritis is not cancer. So generally we say if a person is more than 45 years of age and the person develops new gastritis, like he's having a lot of problem in the upper part of the abdomen, lot of trouble eating food, investigate the patient, investigate the person for cancer. So like that there are many symptoms. So I would not, there is a book which I have written, a booklet which is there, which is downloadable from my websites. You can just search with my name for cancer prevention also. You'll find it very easily. I have covered a lot of points in that which are very important for cancer prevention. So, and awareness of about when it is cancer, when you should suspect cancer in yourself. So those points if you keep in mind, it is more than sufficient. But it's a chapter of an entire book, so I won't be able to tell you every point in an interview like this. But it is very important to know that there are symptoms which have to are called warning signs, for which a person should immediately approach the doctor. Apart from that, remember one more thing, there are screening tests which are available for few of the common cancers. Like, breast cancer has, colon cancer, colon and rectum cancer has. So there are many cancers which have screening tests which can easily detect presence of cancer. And we screen detected means, if you catch the cancer early, the treatment is quite effective. Most of the times we can cure the cancer. So this is the way to identify cancer. The idea of cancer identification should be before the first symptom appear, not after it appears and we wait for many days. It should be identified as early as possible, and that is when the treatment is simple and the and effective. Cure can be achieved very easily.
Very true. So thanks, doctor. Okay, viewers. So I would actually encourage you to be little more cautious on the points which have been covered by the Dr. Nayak. And the next time we actually face any such issues, so we should quickly respond to them and visit a doctor. So, doctor, the next question is that is cancer curable? So, do we have any vaccine for it already?
First of all, first question, the whether cancer is curable. Cancer is one of the most curable diseases, provided the patient comes to us early enough. Today, there are some cancers even stage. See, cancer is staged as stage one to stage four. Stage four is when there is a major spread in the body. Today, there are some stage four cancers also we can try and attempt a cure. We can. So, but a stage one cancer in most of the situation, 99% of the times or more than 90% of the time, we can assure a cure. So that is the difference. So what matters is when the patient comes. If they come early enough, we are able to give them a good result, and the results are exceptionally good today. Most of the times we are able to cure them. So the question usually comes is whether it's a treatable disease or not. If we are able to treat them, we look at, we are attempting the cure. That is how it is. Second part of the question, you're talking about vaccines. Um, See, vaccines are not meant for cancer. Vaccines are meant for cancer. There are some cancers which are caused by infections. Like, there is cervical cancer which is caused by there is human papilloma virus, HPV we call. Liver cancer which is caused by hepatitis B virus. So these two viruses have vaccines. So we are basically avoiding the infection by these viruses which tend to cause cancer. So there is no vaccine as such for cancer. Cancer itself is not one single disease. So you cannot vaccinate for cancer. It's not like smallpox or chickenpox or anything like that. You can There are specific cancers which are caused by infection which have vaccine. Even not all the cancers causing organisms have vaccine. There are these are two main prominent ones which have vaccine against them. So, other important point to which I wanted to tell you was, regarding you asked about cancer curability. You know, there are, for example, hypertension or the high BP or sugar, diabetes. There is no cure for these two. Okay, we cannot cure, we can only control. But cancer, even though it comes under the same category, because they are all called non-infectious chronic diseases. I mean, they are not infectious, they don't spread from person to person. But cancer can be cured. So, but there are diabetes and hypertension which cannot be cured. So you should be actually scared of these diseases because they are quite scary to have them, because you have to bear with them lifelong. You have to control them. Whereas once you finish treatment of cancer, you're free, and at most it is 6 months. After that, the patient is generally only one once in a while follow up. That's all is what is required.
Thank you, Dr. Nayak, for actually throwing some light on the curability of cancer. And I definitely think that the viewers would actually be beneficial after viewing this answer. So the next question I would like to ask you is, which is actually, you can say, the most asked questions from the viewer. So it is like that: can the lifestyle changes help to prevent cancer?
Yes, it can. See, lifestyle is very important factor. How I would put it is, see, imagine your body to be like a new car or a new bike. Now, what is basically lifestyle? You can make a mess out of your car or this thing by not sending, giving it a servicing, riding it roughly. When, you just bombard the car, use it on every possible road. Don't do any maintenance. Use kerosene instead of gasoline. You can do many things with your body same way. You can do smoking, you can have abuse alcohol, you can abuse drugs, you can do anything. So all these things are lifestyle basically, they account to lifestyle. So all this kind of abuse of your body can make, you know uh, create a lot of trouble for your body, and you can increase the risk of getting cancer by doing all this. Whereas if you maintain your body well by maintaining a good lifestyle, moderating on your all abuses which you can already as such indulge in, and moderating your food, having exercises regularly, and all these healthy habits, by inculcating those, you will be able to maintain your body, and your risk of getting these cancers will come down. Cancer as well as other diseases will come down. So it is a basic concept of maintaining you what you have and going on. Unlike car and bike and all, you cannot replace parts here. Remember that we don't get a replacement part. So what you have been given has to be maintained. So that is the only way you can go on and maintain it and go on. There's a simple way to understand life.
Thank you so much, doctor, for this reply, and I hope, and I am pretty sure that the viewers will definitely maintain a healthy lifestyle, especially with the example you gave, the motor vehicles example, and the way you actually made the audience aware about, like, to not get indulged in any of the activities like smoking, drugs, or taking liquor or anything. Even I am going to be working on it and taking my lifestyle to be seriously now. So the
You can
next,
download the book. There is much
yes, sir,
more in that.
definitely, definitely. I would be downloading your book, and I will also encourage the viewers to also download that book, and we will also try to, like, add the link of your book in this description below. So the next question I would like to ask is, can a healthy person also get cancer? Like, if anyone is said to be healthy or anything, so will he also get cancer?
Yes. See, at the end of the day, see all this. It's the same question again. I'll give you motor vehicle. If you maintain your car, if you maintain your bike, can it give trouble? Yes, it can. Even after maintaining it, it can give you trouble. So there is many things. For example, as the car will get older, there is a risk of it getting into trouble. Same way, as you get older, you have a risk of getting diseases. So generally, what we say is anybody above 40 years of age, the damages which have been happening throughout your life starts accumulating enough to cause some trouble as you go older. So generally, as after 40, all these chronic diseases can manifest because the damages have started accumulating. So it is quite common to have diseases manifesting after that age, but you can delay that manifestation or appearing of these diseases by healthy lifestyle and maintaining your body and going on. But that doesn't mean that you will not get it. There is something called bad luck. It can strike you anytime. So if your luck is bad after doing all this, it can happen. just like an accident. You drive very nicely on the road, you are very safe, you are wearing everything, taking all precautions, but one a rogue lorry can come and hit you on the road. Can happen. This is the same way. Okay.
Yeah, Dr. Naik. So I just like the examples you give, and it actually becomes really easier for the audience and as well as for me to actually explain to get understand the questions which I have put and the replies to those. So moving on further, so as we all know that many of us get scared a lot whenever we hear the word chemotherapy. So, is there anything you would like our viewers to know about the chemotherapy procedure and how they can actually not get afraid of hearing this word?
Okay. See, chemotherapy is basically injections of drugs, basically what we call as toxic drugs, which are meant for killing the cancer. Okay, so now they are toxic, means they are, their purpose is to kill the cell. The idea is that the cancer cell should be killed. Now they have lot of toxicity. Definitely, everybody know about it. Everybody knows about it. So, the best way to avoid this chemotherapy is to come early. Means if if a cancer is detected early, the idea is to avoid chemotherapy, the side effect of chemotherapy. You can just get surgery done and go home. More delay you cause, more likelihood that you will get chemotherapy. So these chemotherapy, as like mainly for in third stage and all that, it becomes mandatory to give chemotherapy because you want a control of the disease. The risk of recurrence or coming cancer coming back is high in those cases. So you want to control these or recurrences. You want to avoid the risk of or reduce the risk of getting recurrences, and for that reason you are giving chemotherapy. And unless it is indicated, there's no point in giving it also. So the reason is very clear. To give chemotherapy, there are reasons. So if there is a benefit, we would definitely advise it. But yeah, having said that, today there are many ways to avoid the uh, complication related to chemotherapy. Like for example, when we want to most of the for most of the patients today, we put what is called as chemo port here. Chemo port is something, see, most commonly patients say, it's very painful to get chemotherapy because they have to get pricks, multiple pricks. But today there is a device which we put here, which the chemotherapy doctor can directly prick and give inside. So the pain is very, very less. So most of the patients today opt for that because they don't want to go through this multiple pricks and all that. There are many other side effects which people can try and avoid by taking many medications are available today. So when it is not avoidable, of course there are things which have been uh, are available to reduce the trauma to the patient. But yes, but some bit of trauma or some bit of side effects will be there whatever we do.
So definitely, sir, I am pretty sure that me and as well as the audience are feeling better, and we are not thinking the same way we used to think earlier about the word chemotherapy. And you introduced a new word with us, which is the chemo pore, and you told us about it and how it is done now. So I would say that it was indeed a very wonderful interview with you, Dr. Nayak. So is there anything you would like our viewers to know? Anything you have missed and or we have missed asking you, especially in this COVID time?
You see, I have seen many people thinking that COVID is more dangerous than cancer. Let me bring the statistics right. Even in the peak of the COVID death, which was happening across the world, the statistics actually are telling that the deaths due to cancer was much higher than the COVID deaths. So, in fact, cancer has always been the cardiovascular means heart related and the cancer are the top two causes of death across the world. And the most recent data says the cancer is the highest cause of death as of now. So we are looking at a disease which is a controllable, curable disease, but because people are not identifying it in time and delaying coming to the doctor are killing themselves. It's very simple. Many things in the cancer are very simple to diagnose and get. It's very simple to get themselves to a doctor and get a cure, but they don't end up with the right kind of a doctor and end up in a lot of trouble because of these reasons. Because they go sometimes, people do end up with wrong doctors also, where the kind of specialists they end up with, or they will end up with some quacks or some other forms of medical doctor who do not understand what is going on, and the patient just keeps on in that same system. See, cancer treatment is a very systematic treatment. In fact, most of the times when a patient comes to a proper oncologist or oncosurgeon, we'll put a chain of treatments. We'll say this after this after this, these things can happen, these are the possibilities. So we put a flow chart for the patient and tell, because cancer treatment is a sequence usually. So we want the patient to know the entire sequence. It is not just one thing and then it's over. So that sequence has to be maintained by the patient. So for that reason, if somebody does not plan it for you in that fashion, there's something wrong with the treatment itself. So is not one thing, nobody. And second thing, which is very important to understand it, is if somebody is telling you, I'm going to cure you, 100% I'm going to cure you, there is grossly something wrong. Because nobody can tell you that your disease can be cured 100%. There is always that 1% or 2% where there is a problem. So we can say it's a good disease, we will be able to give you results, but it is not that 100%. You have to follow the treatment and we see that your future is good. So these are the some important points which I can tell you. There are many things. If you keep on digging into things, I'll keep on talking, but I think by far we have covered most of it.
Sure, so Dr. Sandeep. So I believe that we have covered mostly all the points and all the frequently asked questions from our viewers. And you have also talked about few things which you thought that you which were important to be included in the interview today. So thank you so much, Doctor, for having some time for the interview today. And it was actually a pleasure interviewing you today. So, audience, we have included Dr. Nayak's contact details in the description below, along with this video. So, please feel free to contact him in case you feel anything related to questions, or you want to go for a consultation with him. You can also visit our website www.bestdoctor.co.in if you have any questions or suggestions for us or the doctor. He's also listed on our website. You can just search Dr. Sandeep Nayak. So once again, thank you, Dr. Sandeep Nayak, to be with us, taking some time from your busy schedule. We look forward to more such interactive sessions with you. Thank you.
Thank you, Manu. Thanks for having me.
Thank you, sir. Thank you.